From the moment we're born, our nervous system gives us feedback about our world and actions. When we feel something good or necessary for survival, we get a signal that says, "More, please." This reward pathway is mostly an unconscious system of the brain. Like heart rate, body temperature, and breathing, we have some influence over it, but it mostly works without conscious thought. This deep wiring has a huge influence over our decision-making, but is not really under voluntary control, even in people without addiction. Try it now. Can you stop yourself from thinking about ice cream? Addiction is when this reward pathway in the brain gets rewired. Compulsive behavior is partly an inherited genetic trait. It develops over time by repeated activation of the brain's reward system, what we sometimes call the lizard brain because it is so ancient. Common examples are substances such as alcohol, marijuana, yes, pot can be addictive, opioids, and stimulants. But this rewiring can also take place around sex, gambling, eating, or gaming, just to name a few. The more the activity is repeated, the stronger the neural pathways become. At the same time, the reasonable or executive area of the brain gets bypassed. When a behavior becomes an addiction, some key changes take place. The brain starts to react to one stimulus over all others. As the addiction takes over the reward system, the addicted person will do less and less of other things that used to make their life fulfilling. Other people may notice they are falling short in their performance at work or school. Friends and family may notice changes in their moods and behaviors. Over time, the addictive substance or behavior becomes less pleasurable, and most other things do too. While at first the addiction made the person feel good, now it only helps them stop feeling bad. As the brain and body physically adapt at the tissue level, increasing amounts are needed to get the same effect. This can be quite obvious, such as physical withdrawal symptoms, but a lot of times it is more subtle, like feeling restless, irritable, or discontent. Eventually, the use of a substance or behavior starts to become automatic, a compulsion. It becomes less of a conscious choice and more of a reflex. The addict starts to do the behavior automatically, as if driven by some unforeseen force. That unforeseen force is their reward pathway, which has been hijacked by the disease of addiction. How does it end? Addictive behaviors can be reversed, but it takes time, effort, and patience for the brain to be rewired. The period of physical withdrawal is very uncomfortable and can take weeks or even months. And because this process is unconscious, it can be hard for an addicted person to understand the costs and consequences of their behavior. The good news is that studies show that after as short a period as a year, there can be dramatic changes as the brain recovers.